Hello everyone, my name is Prof Yutao Guo from Chinese PLA General Hospital, Beijing, China. And our study, the title of our study is the thromboembolic and major bleeding in COVID-19 patients. COVID-19 is associated with a high risk of thromboembolic complications, which contributed to the mortality. Wienand's thromboembolism have been commonly reported in critically ill COVID-19 patients. Despite the data on Wienand's thromboembolism and COVID-19, there are more limited data for systemic thromboembolism and the value of anticoagulation regions after balancing the risk of major bleeding. Indeed, there are complex interactive factors which could impact both thromboembolic and bleeding risks that would influence decision making. These aspects including the severity of COVID-19 infection, comorbidities, surgery, drug therapies, and anticoagulant use. We wanted to carry out the present study. The present study aimed to investigate the prevalence of systemic and venous thromboembolism as well as major bleeding and mortality in relation to underlying risk factors and the impact of anticoagulation use amongst the hospitalized patients with COVID-19. We respectively analyzed the patients with COVID-19 infection. The patients with COVID-19 admitted to Wienand Hospital, Wuhan, Hubei, China, between January 8, 2020 to April 7, 2020, were enrolled into the study and excluded 7 patients with incomplete medical records. 1,125 patients entered the final analysis. 5 aspect factors were assessed. They were as follows: COVID-19 severity, comorbidities, invasive procedure surgery, anticoagulation drugs, and antithrombotic drugs. And the rates of thromboembolism, major bleeding events, and all-cause deaths were investigated, and Cox proportional hazards models were used to analyze risk factors associated with clinical events after adjusting for underlying risk factors. In this study, our principal findings are as following. Both thromboembolic major bleeding and mortality risks were high, with crude in-hospital rates of 7.3%, 11.4%, and 8.1% respectively. Number 2, age was an independent risk factors for all clinical events. Liver dysfunction predicted both thromboembolism and bleeding events. Both oral anticoagulant and parenteral anticoagulants reduced the risk for thromboembolism. Especially parenteral anticoagulants reduced the risk for the composite outcome of thromboembolism, major bleeding, and death. Finally, subgroup analysis showed atrial fibrillation rhythm increased the risk for systemic thromboembolism. That's a major finding of the study. In conclusion, patients with coronavirus 19 were at high risk for thromboembolic and bleeding events, as well as mortality. Anticoagulant use, especially parenteral anticoagulants, significantly reduce the risk for composite outcome of thromboembolism, bleeding events, and deaths. The presence of atrial fibrillation was a contributor to systemic thromboembolism in coronavirus 19 patients. Based on our study, we showed the anticoagulants would be beneficial for the patients infected with coronavirus 19 after adjusting for the confounders, especially for the high risk for the patients with high risk for both thromboembolism and major bleeding. The parenteral anticoagulant could be considered as an option to prevent the clinical events. Besides, even for the even for the mild and moderate coronavirus 19 infection, the anticoagulant approach should be considered aimed for both systemic and venous thromboembolism. In this study, we didn't analyze the dosage and the anticoagulant type, and it's related to the outcome. So in the next, we would explore further that the dosage of the anticoagulant and the different anticoagulant region and its effect in the clinical events after balancing the thromboembolic and major bleeding risk. To our knowledge, we have known the excessive inflammation has been suggested as one of main drivers to activate blood coagulation in severely ill patients. However, besides the coronavirus 19 infection itself, comorbidities such as hypertension, atrial fibrillation, liver dysfunction, renal dysfunction, etc., may contribute to thrombotic risk, even in mild or moderate coronavirus 19 patients. So, when we consider the prevention for the thromboembolic risk for coronavirus 19 infection, we could consider the thromboprophylaxis approach aimed to prevent both systemic and venous thromboembolism events, even for mild and moderately ill coronavirus 19 patients. Besides, besides the age, severity of coronavirus 19 infection contributed to the risk for the thromboembolic risk. Liver dysfunction would be ignored, especially suggested the patients could be at the high risk for both thromboembolic and major bleeding. So if we observed the patients suffered the liver dysfunction, we should be cautious about the anticoagulation approach. Thank you.